Good morning, this is Dr. Richard Fleming. Today is the 14th of August, 2020. I wanted to pick up on where we left off during our last YouTube broadcast, where we were briefly talking about the treatment of hydroxychloroquine, azithromycin, and zinc in the pre-hospital setting. I realized that the recording on the last one was not as good as some of the other recordings, so I wanted to re-emphasize some of what was being said at that point in time. The disconnect between different individuals talking to you about COVID-19 is a result of a variety of problems, most of which results from a failure to actually measure what's going on with COVID-19. The use of PCR testing can be amplified to give an almost positive result in just about anybody if they have any type of COVID-19 virus particles in their nose or in their throat. And the detectability of antibodies doesn't guarantee immunity to a new infection, and it also isn't quite as credible as they first made it out to be. The real testing for COVID-19 requires that we look into the lungs primarily where it's at. We can look at other places, but we know it's going to be in the lungs if there's a real pneumonia. And pneumonia, to answer the question that some people have asked me, simply means an infection in the lungs. It doesn't tell you what the infection is due to. Presumptively, in individuals who have COVID-19, it's a COVID-19 viral pneumonia. This also gets into the interpretation of whether germ theory or viruses really exist, and there's a number of people who would like you to believe that viruses don't exist, that exosomes that are released from cells to communicate with other cells in the body are actually what's being seen. That's why testing is so important, so that we can discern the difference between fantasy, like the terrain theory, and reality, like germ theory. Because if you can't figure out what the real problem is, you don't stand a ghost of a chance of actually treating it. Hydroxychloroquine may or may not work in the pre-hospital setting. There's reason to believe that it does, but unfortunately, those physicians have refused to test people to really determine if the hydroxychloroquine is the reason why the people are not getting hospitalized, or if it's just the people themselves getting better. We know that those individuals who are going to get worse, the ones that are going to have the inflammation or swelling and the blood clotting, the thrombotic part, are the ones that are either very young and have no significantly developed immune system, the immune naive, or those individuals who already have an overly active immune system, which we call the comorbidities, the overweight, the high blood pressure individuals, heart disease, cancer, the list goes on, you've heard it before. The truth of what needs to be done to determine if a treatment works is the ability to measure before and after treatment. And the image that you're seeing up here at the top of this screen, there we go, top of the screen, is an FMTVDM image. FMTVDM measures changes in blood flow and metabolism, and by doing so, it can determine whether disease is getting better or worse as a result of treatment. To go to the exosome or terrain theory approach of this, exosomes don't have mitochondria and they don't have increased blood flow. FMTVDM measures changes in regional blood flow or increases in it, and increased metabolic function, which occurs either because you have an infection from the body coming in to deal with the infection, or the fact that the virus is itself using the cells of your body to make more of it, which is an increased metabolic activity. The images that you see up here in the corner, the CVP stands for coronavirus pneumonia. And you can see several regions that appear black that we have circled with numbers. Those numbers tell us just how much activity is going on there. The goal would be to do this image before you actually start somebody on treatment, then begin the treatment for COVID-19, And 3 days later, after the treatment has had a chance to have an effect, to then repeat this and to actually measure changes. There's really only two ways to measure changes that are going on. FMTVDM is the only quantitative way to do it non-invasively. And the alternative is to go and take specimens of the lungs every few days to see if there's any change and look at it under the microscope. That itself is open to some interpretation and takes some time to do. FMTVDM can be done at the bedside of the patient, and the results can be obtained in the amount of time it takes for the nuclear technologist to actually develop the images. The individuals that are being admitted to the hospital, I would argue, should have this done because they're critical enough that they've required admission to the hospital, and they're going to need more medications and treatment. Paying attention to the attachment of the virus and its ability to replicate itself, which we've talked about briefly before, the oxygenation capability, and the response, at least initially, to the cytotoxic response. And it's that cytotoxic response that now appears to be what they're trying to target for vaccine therapies. Bearing in mind that when vaccines are given to people, the goal is to shorten the duration of the infection itself and not to actually prevent the infection. We'll talk more about vaccines in upcoming videos, but for now I wanted to address the fact that we haven't been measuring what's going on at the tissue level with any of these treatments and outside of our study, and the results demonstrate which drugs work and which ones don't work. And this also allows us to fine tune what's going on, and that's provided insight for our group to have a better understanding of which drugs should be started when. And hopefully we'll be sharing more of that with you in the not too distant future. In the meantime, I would just simply point out the importance of being able to measure what's happening in individuals and using actual scientific methods to determine whether treatments are or are not working. Thank you.